So today we're going to talk all things obesity medicine, weight loss, diets, medication. We're going to go through a lot. So hopefully you have something to jot your questions down on, and I'm happy to answer any of them. I am the director and owner of Empower Wellness here in Madison, Wisconsin. I focus on hormone therapy and weight loss services and am enjoying very much taking care of that patient population. I'm triple board certified in family medicine, lifestyle medicine, and obesity medicine. So here are the topics for the day. We're going to go over a little bit about what happens when we are overweight. What does obesity or fat cells, what do they do to us? Why is it important that we achieve and maintain a healthy weight? Then we'll go over the diets that are popular today, what's recommended medically and what's not so recommended, and what will work for you or not. And then we'll go over all of the medications that are available, which I'm sure you guys will have some questions for me on that. So sadly, back in 1960, only 13% of us were overweight or obese. And now about 40% of us are struggling with our weight. And even more alarming is almost 75% of young adults are at least overweight, if not obese. So this is something that we really need to address because we're starting to see more of the health challenges that come along with carrying extra weight, which we'll talk about. So fat cells, which are called adipocytes, are very metabolically active. They are an endocrine hormone. They are endocrine organ. They are extremely metabolically active. As you can see from the picture here, that fat cells have a robust blood supply. And in that blood supply is a lot of inflammatory markers, immune cells, all kinds of different cells that are constantly trying to keep those fat cells healthy. And then that also, all of that inflammation, those cell breakdown products go through the liver, which encourages fatty liver or even cirrhosis of the liver. And then we'll talk about all the other body systems that are affected by just this chronic level of inflammation. And to add insult to injury, not only is fat very metabolically active and inflammatory, fat itself decreases adiponectin, which is a hormone that is anti-inflammatory. So if you are a lean person, you have more adiponectin and you are less inflamed just because you're lean. Cruel. So this slide is really busy, and I just wanted to highlight some of the things that just carrying extra weight on us can do. One of the main drivers is insulin resistance. So with those inflammatory signals, it makes it much harder for our body to process blood sugar, and that leads to diabetes. That also, like I had said in the previous slide, leads to fat infiltration of the liver, fatty liver, and can lead to cirrhosis, just like alcoholic cirrhosis, which some of us unfortunately may know some people who succumb to that disease. We are seeing people succumb to cirrhosis from being overweight. And we're seeing it in children and young adults now. So it's very concerning that we get this kind of dialed in for everybody. This inflammation affects the working of the pancreas, which is where your insulin is made. It also affects your gut. People don't think about that. You often hear about people talking about the gut microbiome or having a healthy gut. You have more inflammatory cells in your gut, much more if you are overweight than if you're lean. And some of that comes from what is being fed in the gut by carrying excess weight. The bacteria that you start to grow in your gut is actually inflammatory. And if you lose weight or are lean, you have more bacteria that is anti-inflammatory in your gut. That's why people who carry a lot of extra weight often have issues with constipation or diarrhea, is because their gut is just constantly inflamed. That inflammation can affect your joints. You can have fat infiltrate into your muscles. So you can get more fat kind of interspersed in your muscles, which decreases your muscles' ability to take up blood sugar. And again, we're talking about a higher risk of obesity or of diabetes, excuse me. There's more blood pressure just because of the blood volume that is necessary to keep fat cells alive. That's hard on your kidneys. This also affects your small vessels, which can affect your brain health and lead to more dementia. So, many people have heard about metabolic syndrome. It's these five pillars of having extra weight around our middle, which leads to insulin resistance and diabetes, which then has a three-prong problem of high blood pressure, high triglycerides, which are a type of cholesterol, and low good cholesterol. All of that's inflammatory. So I put this picture in here so you can see kind of a picture is worth more than 1,000 words. So over here, we talk about just carrying extra weight causes increased heart disease, diabetes, high cholesterol, high blood pressure, causes the pancreas not to work well, again, diabetes. All manner of cancers are fed by having extra fat cells. Breast, uterus, cervix, colon, esophagus, pancreas, kidney, prostate, a whole host of cancers. People are always looking for how can I prevent cancer? Your number one cancer prevention is getting and maintaining a healthy weight. People who carry extra weight have a lot of skin problems because the skin is affected by the stretch of carrying extra weight. You can have problems with your gallbladder, increased gallstones, and more high risk of having to have your gallbladder taken out. We talked about fatty liver. And then people don't often realize how much problem you can have with your lungs. Just from carrying extra weight on your chest, you can have significant resistance in your lungs, and it can lead to increased sleep apnea or even almost like a COPD. If you've seen smokers who have chronic obstructive pulmonary disease, it can do something very similar just from carrying extra weight. So now I'm going to digress briefly. The next two slides are not to brag, it's to show you that I've been there, I've done that, I know the struggle. Because you look at me now and you think, well, what do you know about obesity? I spent most of my young life obese. I grew up in a family where our food was canned food or frozen TV dinners. There were always cookies and chips around, a lot of fast food. And this is not an insult to my parents, but it definitely took me a long time to realize how to care for and feed and nourish my body to be healthy. So this was me circa 2015. When I realized I did more yelling after my children instead of playing with them. I had joint pain, prediabetes, high cholesterol, and I thought, I am not even 40 and I'm looking at some serious health problems. So I did a lot of research on nutrition, started to exercise very slowly. I can help you if you're very overweight. I can help you. You can't just start running when you're 100 pounds overweight. So I lost a lot of weight in my 20s and I gained it right back because I tried fad diets. We'll talk about fad diets later. They don't work. So I gained the weight back and then I lost it again, but I got pretty depressed because my skin was loose. So I thought, great, I'm healthy, but now I look like a Salvador Dali painting. So that's when I got into bodybuilding. So we'll talk about how muscle building also helps with uh, your metabolism. So that's me. In 2023, I had a very successful season of bodybuilding, and now I'm just trying to maintain a healthy, active life and nourish my body. But I know the challenges of being overweight. I also know the challenges of being extremely lean, which is helpful because I'll have some patients who lose a lot of weight, and then it's very difficult for them to lose that last little bit that they so badly want to lose. And I do know how to do that. I don't think it's healthy at all to live at nearly single digit body fat, but I do know what it takes to get there. So, how do we lose weight and keep it off? I already made the mistake of losing 100 pounds, gaining 100 pounds, and losing it again. So, I'm going to help you not make those mistakes. This is my fun slide. It's complicated. You've been doing it wrong the whole time. Tell your friends, put your scale up in the air, then you'll get a better weight. So the most important thing I can teach you about diet today is whatever works for you is the best diet. And the best doctor to help you with that is somebody who will work with you. Sit down, talk about what are your habits, what do you eat, what do you like, what do you not like, what does your time look like, what's your budget. This is quite a process because you have to start wherever you are now and start to make changes to get you closer to a healthier, ideal lifestyle and diet. I've had patients who eat out every single meal, not kidding, and then learn to make healthier choices doing that, then slowly learn how to cook, maybe do a little meal prep if that fits into your life. And I've had patients very, very successful with weight loss, but it does require quite a bit of commitment to get there, but it's worth it. You'll feel so much better. And all those health conditions I talked about earlier, I have none of them anymore. So that's good. You have to find something you can commit to. The hardest thing about weight loss is commitment. If you eat perfectly for one day and then eat like a raccoon for the next 5, you will not lose weight. It has to be something you can stick to that also works with your life. There will be parties to go to, there will be life events to have, there will be holidays to go to. How do you fit that in so you maintain a healthy weight? And we can work with all of that. So let's talk about diets and nutrition here. So the research shows that a whole food plant-based diet is probably the most robust for cardiovascular health. Do I recommend that? Not necessarily, because let's say you choose a vegan whole food diet, great for your cardiovascular health, but it's hard to maintain enough protein intake to really support healthy muscles, which supports healthy bones. So as we age, if we have falls or medical challenges, you are healthy enough to get better. So I do like the vegan diet, but it requires some serious paying attention to your protein intake. Your protein intake should be about 1.2 to 1.6 grams of protein per kilogram of lean muscle mass. What does that mean? That means kind of ballpark what your ideal weight would be, divide it by 2.2, and that's roughly how many grams of protein you should have in a day. Aim for a little higher than that for just general health as you age. More frail people, elderly people, they need a little bit more, higher, closer to that 1.6 range. So the next diet I'll talk about is the Mediterranean diet, also very healthy for cardiovascular fitness and health in general. It has a little more fat in it, but it's more polyunsaturated, monounsaturated fats like olive oil, fatty fish, avocado, those kinds of things. I don't recommend a keto diet. I'm just going to throw that in there as an aside. A true keto diet by medical professionals is actually very high in fat, not protein. It's the high fat intake that keeps you in ketosis. And for someone who has a seizure disorder, that might be very appropriate for getting your seizures under control. But those really high fat diets are going to cause you to have cardiovascular disease. So I don't recommend that. A lot of people do a ketogenic diet with high protein. Spoiler alert, if you eat a lot of protein, it gets converted to glucose. So you're not actually in ketosis. So I don't recommend a ketose diet. We will talk about why some people are successful on those high protein, low carb diets, though. And then the DASH diet is recommended for high blood pressure. It's the dietary approaches to stop hypertension. This one's been around for a long time. It really focuses on low sodium, low sugar, low saturated fats. But again, you can't force a diet on yourself. You have to work with someone who can help you get closer to a healthy diet within the parameters of your life. So I touched a little bit on protein. Protein is so important. This is what will help you as you age. Because if you do nothing as you age, you eat whatever you want and it's low protein, you will get more fatty infiltration in your muscles. You'll lose about 6 pounds of muscle per decade after the age of 40. So if you keep going like this, by the time you get really old, you're going to have very poor muscle tone. You're going to fall. Your balance is going to be bad. You're going to break bones. None of this is good. Also, just to add to that, if you don't have very good muscles, you are going to have a lower metabolism and you're going to find you can eat even less and gain weight. So if you have some muscle to you, you are going to be able to eat a little bit more, have a little more calorie freedom, as it were, and not have to feel like you're constantly having to restrict yourself to stay at a healthy weight. So get your protein in. By protein, I kind of like this picture actually because I recommend lean protein like chicken, lean cuts of pork, lean beef, actually fatty fish on the other side of that because those are good fats for you. So salmon, tuna, mackerel. For non-meat sources of protein, I recommend low, like not ultra processed options. So like tofu, soy curls, TVP, tempeh, seitan, things like that. Nuts, beans, and seeds, they're great, but they're not that high in protein, so you do need a little help. And the reason I highlight like tofu, tempeh, seitan, soy curls, TVP, those are all fairly unprocessed. TVP, maybe a little bit more. That's texturized vegetable protein. But I really feel pretty comfortable with the process of how that's made. So I'm comfortable with that as a processed product that's still pretty healthy. And fiber. You need fiber to keep you full. You need fiber to feed the good bacteria in your gut. So fiber comes in the form of whole grains, complex carbohydrates, whole fruits. I emphasize that because people will do like ultra processed grains, so they're not getting the whole and the fibrous parts of the plant. You need the whole thing. If you're eating potatoes, try to eat the skin, that kind of thing. If you're eating fruit, try to eat the skin. Um, I was going to say also with high fiber foods, it really helps with your stools as well, so you're not tending toward constipation. And you have to keep yourself hydrated, otherwise fiber turns into a brick. So you have to have enough fluid on board to keep things moving through. So this is where we talk about calories, because people will be like, I hardly eat anything. You probably don't know how much you're eating. Women underestimate our calories by almost 50%. I have a lot of women who say, oh, I'm only eating like 1,500 calories a day. And when we really map it out, it's closer to 3,000. And that's why they're not losing weight. It's hard. It's really hard. But our choices are what make it a lot harder. So I don't know about you, but I don't think I could eat full size chicken breasts, 4 of them in one setting. That's 700 calories. I don't know if I could do that. However, I would have no problem taking down this muffin, which is 740 calories. So that's where we really have to pay attention to the density of the calories in our food. That's why the high protein, low carb diets work. You can't eat that much chicken and vegetables where eating a bunch of carbs is so easy. A slice of cake, a large slice of cake, let's say it's a layer cake with frosting, is almost 1,000 calories. One slice of cake! You get the point. So let's say you're losing weight. I'm going to tell you some things that are kind of depressing about weight loss, but knowledge is power. So as you lose weight, the hormones that tell you you need to eat more get louder. So that stomach growling comes from something called ghrelin, which tells you, hey, I'm hungry. And it's because your body's used to a certain amount of food. So as you lose weight, you have to be a little bit comfortable and learn to sit with that stomach growling. And that's okay. Like, know when you want to eat and what you want to eat. And if you're getting out of control, that's where someone like myself can help you make good choices so that when you're hungry, you don't binge eat. So that's not so great. Then, if you are a very heavy person, you have a higher metabolism. Just to keep those fat cells alive, your metabolism is higher. So as you lose weight, you will need fewer calories to fuel your body. That's why I really recommend plateaus. People get so frustrated in a plateau. I love plateaus. A plateau means you have learned how to maintain something. So when you get to a plateau, celebrate it. I know what I need to eat. I know how I need to move my body to stay at this weight. then make changes and get through that plateau. So plateaus are actually wonderful. I don't want you to continue to lose weight because then when you stop, you're going to go right back up because you haven't learned how to sit with that new weight. And then I always recommend if you are doing absolutely everything you know to be right and you're not losing weight, then it's time to track it. And by that, sometimes I mean even weighing your food, not for a long time, maybe a week, even a few days will give you a huge amount of knowledge on how much are you actually eating. I will tell you when I first started losing weight, I did do this. I tracked, and I was of that team overestimating by almost 50%. I thought my breakfast sandwich that I was having was maybe like 300 calories. It was actually close to 700. So there were a lot of things I discovered along the way that I was like, wow, I'm not even close to what I thought I was doing. Or when I thought I would have a healthy salad, I didn't realize how much a little bit of cheese, some croutons, and a creamy dressing adds. A lot. It adds a lot. All right, let's talk medication. Take a breath. So this can get a little bit sticky, but I'll try to make it as easy to understand as possible. We'll talk about the GLP-1s last because that's the one that most people have heard about, and we'll go into those. There are a lot of other choices, though. So some people, if you're only looking to lose 10, 20 pounds, you may not need something that potent and that expensive. First one up is Orlistat, also called Ally. It's sold over the counter at half the prescription dose. It works by decreasing the absorption of fats. So that is a self-punishing crime. If you decide to eat fettuccine Alfredo on Ally, you are going to be in the bathroom and you are going to suffer because you are going to have catastrophic diarrhea. It's not a terribly popular medication because of that. If you ate super low fat, this medication will do nothing for you. So it works by punishing you. But it does work. You can lose about 5 to 10% of your weight on this. Phentermine is an unloved stepchild that needs therapy because phentermine is great. I would say most doctors don't know what to do with phentermine. Phentermine is best prescribed to you by an obesity medicine specialist because most of what we're taught in medical school is straight up wrong about phentermine. I think most of us thought of it as a stimulant. It's not. It's a sympathomimetic, meaning it stimulates your sympathetic nervous system like a cup of coffee. So it is not super habit forming. A lot of doctors think it is. It's about as habit forming as coffee, which I will say I'm addicted to. But it's not going to cause you to have the shakes or go into bad withdrawal. If you don't have it, you're not going to feel like I have to have this medication. So it's fine. A lot of people think it causes high blood pressure. It doesn't. It doesn't lower your blood pressure though. So you want to make sure your blood pressure is controlled on that because it's going to keep your blood pressure where it is. It can increase anxiety a little bit. So if you're somebody who is very sensitive to caffeine or anxiety in general, not a great medicine for you. Can also cause a very fine tremor. So if you're a surgeon, probably not a great drug. Does not cause heart valve defects. I cannot say this loudly enough. Everybody thinks, oh my gosh, it's going to mess up your heart. That was fenfluramine. You may have remembered the medication called fen-phen. It was discontinued in the 90s because of fenfluramine, which caused heart valve defects. Phentermine's been around since 1959. It does not cause heart valve defects. And I'm excited that there's a new study going on to see what happens if you take phentermine long-term because the original study was only 12 weeks long. That's another reason why if you go to your primary doctor, they're going to say you can only be on this for 4 months. It's because the original study was only that long. We don't know what happens if you take it for a long time. But let me tell you, there have been people on it for decades and they're doing fine. Average weight loss about 5 to 10%, but it can be really helpful in maintaining weight if you've lost some weight. And it can really be helpful with somebody who just needs that little boost to stay in control. So I like phentermine. Qsymia is another one. It has phentermine in it and topiramate. Topiramate is a medicine for headaches and seizures. And they found that when people were taking topiramate, they lost weight. So they put it together with phentermine, even more weight loss. It's a great drug, very effective, but it can cause dry mouth, which can be really annoying to people. And it's definitely a bad drug if you have kidney stones because it can precipitate kidney stones in people who make kidney stones. It won't give you kidney stones, but if you're a stone maker, not a good medication. It is a great drug if you have a soda addiction. If you are a soda pop drinker, it will make it taste terrible. The mechanism of action of the topiramate will make soda taste awful. So sometimes I use it in my soda drinkers. It's effective though. You can lose about 10% of your weight on this. Contrave is less good for weight loss, but for some people it's really appropriate. It has the antidepressant bupropion and the anti-drugs of abuse medication. Oh, I forgot an L in there. I apologize. Naltrexone, not natrexone. Um, this targets the reward center of our brain. So this can be a good one for people who just need something to keep them out of the cookie jar at night. It's not for someone with a seizure disorder. It can lower your seizure threshold. I also really like it for people who maybe drink a little too much or use drugs of abuse. It can help with that as well. So win-win. Little weight loss, keep you in control, and help you not drink as much alcohol. So this one's not a bad choice, but the weight loss is much more modest. All right, GLP-1s. Told you we'd get there. So the original GLP-1s, there are many, but the ones that are used in the weight loss world is semaglutide. Wegovy and Ozempic are both semaglutide. They increase insulin production in the presence of glucose. So some people are worried that it will cause you to go too low with your blood sugar. It does not. It makes more insulin based on what you eat. Can it cause low blood sugar? Yes, but it's pretty mild and not very common. It slows food emptying through your stomach, so you stay fuller longer, and it works on the central part of your brain that tells you, I want a snack. In fact, it's so effective that some people are like, oh, shoot, I need to eat. I didn't eat. So it's very effective. Also helps reduce blood pressure and triglycerides. If you've had friends who say, oh, you should be on these medications, it prevents dementia, it prevents cardiovascular disease, it cures diabetes, all of these things. It's not the medication, it's the weight loss. So if you're a normal weight, I do get people in the office occasionally who are normal weight and they want these medications for brain health. It's not going to help you protect your brain. You're already protecting your brain by being a healthy weight. So GLP-1s are great, great choice. Young people can use them. Elderly people can use them. There are quirks to these medications. Just some random things that can be interesting. If you're really sensitive to changes in dopamine, a neurotransmitter in your brain, you can experience what we call anhedonia, or just kind of a lack of drive to do things. It can just make you feel blah. If you're on the other end, where you have high dopamine, it can make you feel great. You know, you have more energy, you have more interest in things, and you're like, this is the best I've ever felt. And you don't really know which person you are until you try the medication. And then there's some other just random things where it can cause some bladder spasms, and you're like, man, why do I feel like I have a bladder infection? This medication can do that. Other things like that. If you're ever put on these medications, your doctor should be able to go over all the risks and benefits with you. Now, the other one is tirzepatide. Tirzepatide is a GLP-1 and a GIP, which works. These are even more robust medications. They work on both fat loss and insulin sensitivity. They're more potent in there because they arguably are. People can have quite a bit of weight loss with this. So this one, yep, it's great. Love it. Works really, really well. All of these medications can be combined. So if you're someone who is a binge eater, you can use some of these medications in combination. If you've had weight loss surgery before, you can use some of these medications depending on the type of weight loss surgery you've had. So it's not you get one medication and you stick with it, that's it. You can combine or change or cross over depending on what your needs are as you go through your weight loss journey. And then if you're really savvy on Instagram and TikTok, you've probably heard of retatrutide, which is another GLP-1 that has GIP in it and glucagon receptor agonist as well. I'm actually really excited about this one because it supports lean muscle mass. So it helps keep your muscles as you lose weight. As you lose weight, you lose fat and muscle together unless you really work to keep your muscle mass, which you should on any of these medications because you want that muscle to keep you metabolically active and help keep your bones healthy. But retatrutide makes it a little bit easier. This one should come out in like June or July. I anticipate it's not going to be cheap though, but something for you to know. And then I can't stress this enough. Anybody who is on a weight loss or health journey, you have to have all of your house in order. So the nutrition piece, making sure that you're moving your body, managing your stress, getting enough sleep, making sure that you feel like you get up and have a purpose every day, and of course, avoiding risky substances such as drugs and alcohol.